So today I want to talk about the importance of screening for sleep apnea in your hypersomnia patients, narcolepsy, idiopathic hypersomnia, all of those spectrum of disorders, especially if you are just getting the patient, a sleep physician retired and you're taking over and the patient has not had a study in so many years and continues to be on high doses of stimulants or wake promoting agents and not doing great, or complaining of excessive daytime sleepiness, right? Upwards continually above 10, 11. There is always that need to screen for sleep apnea because sleep apnea typically coexists with all of these disorders. So don't miss that. And you don't have to move from one medication to the other if you have not screened for sleep apnea. So always continue to screen for sleep apnea and ensure that, that is not the problem, because over the years things change, medications change, medical history changes, weight changes, hormonal changes also, especially in women who are more at risk of sleep apnea when they get into menopause. So always be on the alert and always know that sleep apnea is still a possibility in the setting of any hypersomnia disorder. And I just had a patient that I acquired from a sleep provider that retired, and she has been on a hypersomnia medications but not doing well. And I was like, let's just test for sleep apnea. And her AHI was 12.8, 3%, AHI was 25. So AHI 4% was 12, 3% was 25. So really significant, right? Desaturation, lowest oxygen was at 84, so really significant sleep apnea. And so if you treat it, she would definitely do better and maybe may need less medications for the idiopathic hypersomnia. So you don't lose a thing by repeating a sleep study, and you educate your patients, because most of them are going to feel like, why are we doing another study? But when you help them understand the need for it, most of them are willing to do that because it's for their benefit that they cut back on these medications that have significant side effects and get on something that is not does not have a really high profile. She can get on an oral appliance. If I use her 4% AHI to treat her, she can get on a PAP machine as well. So yeah, that's the lesson for today. All right, guys, I'll see you in my next video.